The United States is one of the most advanced countries in the world, yet a new survey reveals a number of surprising insights about women's reproductive knowledge and concerns. Our next guest joins us to share some of those survey results. Dr. Jane Minkin is a board-certified obstetrician, gynecologist, and clinical professor at Yale University School of Medicine. Good morning, doctor.
Good morning, Mary. Thank you for having me with you.
It's a pleasure. This poll, what you polled 1,000 women ages 18 to 40 about fertility. What were some of the key findings?
Very surprising findings to me, that of these reasonably well-educated women ages 18 to 40, that indeed the knowledge about reproductive health was very, very limited. That indeed, although about 40% of the women in the survey said they might have concerns about being able to get pregnant, only 20% of the women had actually discussed this with their reproductive health care provider, which was sort of surprising. A third of the women in the study really had no idea that certain basic health issues can have a significant impact on fertility. For example, body weight being too slim or too heavy can actually have a significant impact on ovulating. History of sexually transmitted infections, smoking, all these things can impact that. Yet a third of the women had no idea that these were potential issues as far as getting pregnant. Also, the lack of knowledge about the effect of age on fertility was quite surprising. That indeed 40% of the women in this survey actually thought that women kept on making eggs, that we were like guys making sperm forever. That indeed that they thought we kept making them, and indeed women are unfortunately born with all the eggs we're ever going to have, and we just unfortunately deplete them over the course of time, so our fertility diminishes. Yet 40% of the women in this study really didn't understand that. So I think there's a lot of non-knowledge out there and a lot of ignorance that we can help with.
What advice do you have for women who are struggling to conceive? And it sounds like there are a number of factors that could play into that advice.
Absolutely. Well, one thing that I would encourage women to do is to see their reproductive health care provider on a regular basis to get information. That indeed, if a woman is under the age of 35 and she's been trying to get pregnant now for a year or more, I would strongly encourage her to touch base with her gynecologist to start doing some testing to work on getting her pregnant. And if a woman is over the age of 35 and she's been trying for 6 months or more, she should be in contact with her reproductive health care advisor. Another thing that I would strongly encourage all of our people watching is that if you are thinking about having a baby, get on some folic acid on a daily basis. That 50% of the women in this survey did not know that taking folic acid when you're trying to have a baby actually significantly reduces the risk of having a baby with a birth defect. Women didn't realize that. So again, if you're thinking about having a baby, take that folic acid. It's very helpful. So there's a lot of important information out there. And if your viewers would like to learn some more, the First Response people have sponsored a very good website, excellent website called NoSooner.com. And a lot of information on there as far as fertility, potential planning issues that can be very helpful. So again, NoSooner.com I think would be very helpful with a lot of information.
Doctor, we have less than a minute. What are the reasons that women aren't talking to their doctors about concerns? Is it embarrassment, social stigma? What do you hear?
Well, I think all the above are there. I think that women just basically don't understand that these are potential issues. And I think there's a significant disconnect. Although women, yeah, they hear about fertility, and yeah, 40% of the women think they might have a problem getting pregnant. Many of these people will, it's not going to happen to me, so I don't have to worry about it. So I would strongly, again, encourage women to talk with their healthcare providers, because indeed in the survey, 75% of the women said they thought their female healthcare provider was their most important resource of this information. So don't be afraid that we're out there and we really want to help. And I view my job as a gynecologist is to help women have a baby when they want to have a baby, make them not have a baby when they don't want to have a baby. So I think that's very simple stuff that all of us in gynecology, nurse practitioners, PAs, we're all interested in helping women along those lines.
Doctor, thanks for your time today. This has been informative.
Thanks so much, Mary. Again, to NoSooner.com for our watchers here.
Excellent. Thank you. Mike?